Dr. Ferranti, you're on, sir.
Okay. Well, good afternoon, everyone. Let's begin with the next session. One way of making the link, my name is David Ferranti, and I'm the President of Results for Development, R4D, and have been asked to moderate this session. And one way of making the link between this morning and where we might feel we should go is for all of us to encourage each other to move on in the following way. We heard a lot about what is and what should be, and the obvious next question is how do we get from what is to what should be? So the what is this morning has been some statistics as to how big the issues are, some sense of what's not working, a great introduction to that. And the what should be has touched upon what's right, what's needed. But if we really want to make a difference, we have to figure out how to get from what is to what should be. In this session, our first speaker will be Peter Berman from the Harvard School of Public Health and is a planning committee member. And as you know, all the bios are in the book, so our instructions are to be fairly brief. And Peter will be followed by Lorna Friedman from a partner Global Health Management at Mercer. And then, as a special treat, we have Oriel Solar, who is on the screen now from Chile. She's with the TASTE program in Chile. And so we're going to test ourselves and our technology to see if we can do that online. Welcome, Oriel. And our last panelist is, in the midst of many logistical problems to get here, Marlace Barber, and if she does, she's from Medical Director Lockheed Martin, also a planning committee member, and if she does, we'll factor her in. If she doesn't, we'll find another time during the program. Oh, here she goes. Oh, yay. I think you actually just staged that, didn't you? And it worked. And as we talk about this question of how to get from what is to what should be, there are a couple of questions that the planning committee drew attention to for this session. One is, how are those within the formal sector to be assured coverage now? How might they be assured coverage under different models of financing and delivery reform? And secondly, what are some of the policy and political economy issues that may arise with different approaches to advancing along the path to UHC with special attention to informal sector groups? Those are questions for all of us, not necessarily for our panelists who've already prepared their presentations. We will follow a format of the presentations, a few questions in between, just so you don't have to go through 80 minutes of no chance to speak, and then hope to have a lively discussion at the end. So I hope you'll be thinking about your questions, not only for the panelists, but also on this question of how do we get from what is to what should be. Peter.